Hi, Dr. Paul Coleman here, Coleman Center for Cosmetic Dentistry. I want to kind of explain something that seemed like common sense to everybody, but I want to just demystify the first experience you're actually going to have in a dental office, which is an exam. I may do mine just slightly different, and it might be a little longer than most people are used to in the past, but that's because you deserve to have my complete attention and a really detailed look at your current situation. So I'm just going to break it down into stages on what I personally go through when a new patient comes in. The most important thing is actually to kind of get to know the patient. I mean, before you just start jumping down their mouth, you got to sort of know about what the patient is all about, what their situation is, and most of all, what they really desire from me. We offer a vast array of things, whether it be sleep medicine or sedation or Invisalign, but not everybody wants all of these things. Just to find out exactly what the patient would really desire for themselves is really the first step in treatment planning any case, whether it be little or small. The next thing you really have to talk about is medical history. A lot of patients kind of filter that question, any changes to medical history, when you see the hygienist. And it's amazing how much isn't presented to us, which many times can be pretty important. If you've been taking Fosamax for osteoporosis, we shouldn't be doing an extraction. But osteoporosis isn't something that most patients think, well, this dentist needs to know anything about it. It's vitally important that you actually search out and find all of this stuff, drugs, drug interactions, and those kind of things, so that we can do things as safely as possible, frankly. After we get through with that, then we really move into a data accumulation stage. We do a real thorough examination of the head, neck, the muscles, the TM joint, because a lot of people kind of get used to little problems as they get older, and they assume it's part of the aging process, and it's not necessarily the case. Maybe these problems are just exhibiting themselves as we're under more stress or later in life. We take a good look around the mouth. We're looking for oral cancers, very common, and if it's not treated in the early stages, can have pretty fatal results. So that's a real important part of the exam. We want to look at the gum tissue. We want to take those little measuring sticks and slide down between your tooth and your gum and find out the depth of the pockets. It's pretty obvious by the time you take x-rays if gum disease is advanced, but at this point in time you can find out if a spot in the mouth is bleeding when you probe. Bleeding means infection, so anytime you're having a gum exam and they say bleeding, substitute a word, say infection. Now, if blood was pouring out of your ear, you'd probably think, hey, this is pretty serious. But so many people's gums have been so bad for so long, they think it's kind of normal to spit out pink toothpaste. In health, not so much. Then we want to look at existing dentistry. Is it holding up? Is it wearing down? Is it breaking down? Are there problems? Are there decay areas or wear or facets on the teeth or recession or things that we can not only alleviate but prevent from occurring perhaps in the future? Then we like to get a real good set of x-rays. I tend to take digital x-rays here. It's a lot less radiation, and I can actually make this as large as I want. I just have to buy a bigger monitor. For 25 years, you know, we used the old film things, then we'd stand up to the window and kind of point with a pencil and try to point out something small on that patient, and you kind of look at you with this glassy eye like, yeah, I see that spot. But this is kind of neat. You can really play with this, and if the radiation level wasn't like the absolute best, we could modify it within the thing without taking extra x-rays, and it really comes in handy. The other thing I like to do a lot of is photos. Now, for years, at one time, frankly, you know, if there was a tooth in the back that had a crack in it, I'd pick up a piece of paper and I'd draw a tooth and say, okay, the filling's about this big and the crack is right here. A picture's worth 1,000 words, and it's a lot easier for me to point to an area and say, boy, your gums are a little bit red up here. This is actually my son, so I don't have any HIPAA requirements here. Anyways, it's really nice to be able to really just blow things up as big as you want to, and frankly I can even zoom in on any little section of this to make it even larger, because it's really important that the patient owns their problem. Too often we get in a situation where sometimes I care more about the patient's health than the patient does, but if they understand it's their problem, then I don't really have to sell anything. I just suggest solutions and they say yes and no. Whatever they decide is perfectly okay. Oftentimes we'll also do some study models on a larger case. So we'll take some impressions of your mouth and mount them up, and we can use this as a diagnostic tool to help formulate a treatment plan. So at that point in time, if it's a fairly simple set of problems, we can talk about what can be done with alternatives and perhaps staging. Well, maybe you want to take care of these 2 teeth now, or those 2 later, or maybe you want sedation and get it all done, in one morning. But whatever it is, once the patient understands what's going on in their mouth, then the solutions make so much sense. Sometimes in larger cases, I actually have to bring the patient back because, frankly, I have to come up with 2 or 3 different treatment plans depending on what they desire and their financial ability to cover what they really want at this point. But I think it's important that you end up knowing the pluses and minuses of any material you use, any type of procedure that's offered, and what your expected results in longevity from these things are. So, in short, that's a new patient exam at my particular joint. My particular joint is the Coleman Center for Cosmetic Dentistry. If you want some more information about the place, check out the website, www.drpaulcoleman.com. Thank you.